My name is Mobin, and I'm part of the Innovation and Action Group Regeneration. We believe that the future of sustainability is in regeneration, which can be defined by replenishing and restoring what we've lost and building economies and communities that thrive while allowing the planet to thrive too. The surrounding community of U of M, Ann Arbor, is one of the healthiest and happiest cities in the state, yet also one of the most divided. By looking at some of the health disparities in Washtenaw County, Ann Arbor is the eighth most economically segregated metro in the country. And according to Michigan Department of Health and Human Service analysis, Black members of the county lived an average 13 years less than white members, while Latino members lived 20 years less. And during the pandemic, these health inequalities only widened. Despite being only 12% of the county population, Black residents currently account for 22% of COVID deaths and 27% of county hospitalizations. The root of this disparity is a common story in America, one of inaccess. Whether it's healthcare, food, or housing, or lack of access can have fatal and lasting consequences on members of our community. So to explore ways to ensure equity in the ending of the pandemic, we decided that our challenge was to increase accessibility of the COVID-19 vaccine and quality information regarding it to community members in Washtenaw County. So the question then became, how can we address issues these large of inaccess in healthcare? So to find an answer, we looked at various stakeholders with ties to the community. Through surveys we sent out to Washtenaw County community members, we noticed that access to COVID resources were among the most difficult to obtain when compared to other resources like food or Wi-Fi. Then we interviewed county commissioners to gauge what their greatest issues facing their constituents. From then, we identified that distance was a major barrier to healthcare equity. In one sense, along the rural parts of the western parts of the county, there's as many as 25 minutes away from any urgent care facilities. On the other hand, the common problem along the eastern part of the county, Washtenaw, is an emotional distance manifested by distrust and prohibitive cost of healthcare institutions. We then talked to a professor of public health who let us know that in the coming months of the pandemic, hesitancy and distrust of the vaccine will most likely become one of the most greatest ensuing challenges. Finally, from the help of leaders of the Mobile Support Service Initiative, we're able to be introduced to the issue of inaccessibility of resources in Washtenaw County. To jumpstart our project, MSSI said they could provide 2 Ann Arbor transit buses near the end of their life cycle, which can be retrofitted to fit the community's needs and bring resources where they're needed. All in all, they're able to provide a total budget of $100,000 of implementing a design. So to help against the current issue of vaccine distribution, our design would incorporate storage and refrigeration units, as well as stations to administer vaccines and see patients. The design will be versatile so that after COVID vaccines, we can efficiently adjust the functionality to meet the community's current and most pressing needs. To increase involvement, we intend to roll out the design with a parallel public information campaign to spread awareness and official information regarding the bus and vaccine. By traveling to communities or places of work, we can meet the community where they're at, physically and emotionally, and provide them with the convenience and information to help alleviate any remaining barriers to getting a vaccine.
Hello, everyone. My name is Rania, and I'm going to be discussing our solution further. Our solution is based on evaluating the changing needs of the community, from administering the COVID-19 vaccine to possibly all vaccines and other health services in the future. These services could include the flu and shingles vaccines, for example, primary health care, and cancer screenings, to name a few. We will repurpose the old buses to fit those needs and acquire new buses once the current bus lifetime ends. This circular model will allow us to best serve the community with their current needs. Our key partners include the Mobile Support Services Initiative, as mentioned earlier, and medical professionals. Our success will be achieved through partnerships with local physicians, hospitals, and community organizations. And our sustainable model connects back to our team's mission of regenerating communities by developing and furthering healthcare infrastructure to best support local marginalized populations. The current market has various issues, including funding, accessibility, distrust for health services, and a lack of awareness about county-provided resources. Communities, especially Chelsea and Manchester and parts of Western Washtenaw County, do not have convenient access to healthcare, and many people do not have mobility to travel to a hospital or care center. Marginalized groups from Eastern Washtenaw County are physically close to services without a willingness to trust them. We aim to reach a wide range of users across Washtenaw County by utilizing the buses and local doctors to help spread awareness about the COVID-19 vaccine. By partnering with local community organizations, doctors, and employers to answer questions and provide assurances on board the bus, we aim to reach a wider base of community members and close the boundary between lack of awareness and distrust and public health services. As the percentage of vaccinated population increases, buses can be used to address the spectrum of vaccine hesitancy, including people who are skeptical, some people who may be deliberating but waiting to see longer-term effects, and others who may have decided to get the vaccine but don't have access. We can address these concerns with the spread of information and endorsement from trusted local doctors. Moving forward past the pandemic, the modular design can allow for a more holistic approach to bringing public health resources to community members. Issues with awareness of available mental health resources can also be alleviated with the spread of information or flyers on services offered by the county, and say workshops or sessions on mental health issues that could be held in the bus. We plan to have a design finalized by summer of 2021 and implemented by the fall of 2021. And given our timeline, we would most likely be focusing on populations on the spectrum of vaccine hesitancy. Overall, our solution works to increase accessibility to resources in more marginalized areas of Washtenaw County, focusing on the main pillar of regeneration, replenishing and restoring to build communities that thrive. Our team is made up of members from a university design team with the mission of co-designing sustainable, culturally appropriate technologies with local communities to improve quality of life. We all have prior skills and knowledge of the design process and believe our technical and collaboration strengths will contribute to our success in the Innovation and Action Challenge, as well relating back to regeneration and our challenge of increasing accessibility to the COVID-19 vaccine. Thank you so much for listening, and we hope you enjoyed our presentation.
Great job, team. You had 11 seconds left. I haven't had to raise my hand yet. That's so great. All right, Liz, Suzy, who wants to jump in first?
I would love to jump in. Y'all, I teared up in this presentation. This is incredible. It's so ambitious and timely, and I'm just in complete awe. My questions mostly pertain to the stakeholder engagement that you've done with the medical community, because this is an incredible idea, and I really hope that you can succeed. And I know there are challenges in navigating sort of finding the legitimate channels to get the vaccine and professionals to distribute it. Those sort of things are going to be coming up quick. So could you tell me more about that?
Yeah, definitely, because a lot of our, I guess our entire design is, none of us are super knowledgeable on public health for sure. Really exciting that we hope to kind of do as a team is actually in the round two presentation. Megan, one of the friends of our IA, actually has all these connections, including to Packard Health. That's also, I'm sorry if I cut out actually also, but is thinking about a mobile vaccine sort of bus. So we're hoping to see what they're doing. We definitely need to get into more stakeholder interviews with medical professionals, I would say, though.
Wow, I'll go next. As Suzy said, what a fantastic presentation. I also teared up a little. So if that's a measure of the effectiveness of your appeal of your presentation, then I think it speaks for itself. So I want to, let's see, I want to focus on a couple of things. One is the question of, well, actually, I'm going to change the way I'm going to ask the question. What do you guys know about current efforts to reach these populations? I do know that within Washtenaw County, I serve as a volunteer in the vaccination clinic world. And I know that the county has already put up some pop-up vaccine sites in order to bring vaccinations into communities rather than making them sort of only available to people that can travel to them. So did you talk to the county commissioners about any of those efforts? And what do you see as the strengths and weaknesses of those relative to your solution? And then I've got sort of a follow-on, which is, you know, the mobile clinic, you can get even closer to the communities, but I'm wondering if there's a downside to that too, which might be perceptions of legitimacy or, you know, who's really up to this, who's really doing this. And so how do you deal with those possible concerns about, you know, having a bus show up in the community and, you know, asking people to trust that they're going to get the kind of service, the kind of quality health care that they might get if they showed up at University of Michigan Hospital or the VA hospital or some other clinic. So there's sort of a question about existing data as well as about credibility of the solution.
Yeah, so to answer your first question, we talked to a leader in the community in like the largest neighborhood in Ypsilanti, where I think the majority of the pop-up vaccination centers are, and she had actually volunteered to kind of be a point of contact for people in the community. So she said that those were working well, but I think they're centralized to Ypsilanti and not as much on more of like the western side. So we're not as educated, I guess, on like the western side, but I do know that some people were felt like they didn't have access to the point of like going to Ohio to go and get vaccinated. So trying to like, I guess, address the lack of access in the western side and the lack of trust, I guess, in the eastern side. And for your second question, that is also something we talked about with the same person who had dealt with like a perception issue. And we spoke about it more in like the sense of like it's already in churches and community centers to give vaccines, and there's already like this sense of like people are getting more comfortable with it. And especially with Packard Health, who is working on trying to do this. So if we're able to get a good amount of knowledge from them and kind of like work with Packard Health as we plan to do, and learn from them, I think trying to get the perception and having like the endorsements from community doctors and well-known medical professionals in the area.
Thank you.
I think we have time for one more question if Suzy or Liz has one.
Have y'all looked into the potential for state and federal support of this effort? If you can stand this up, you know, I think there's a world of funding that could help sustain you. Is that something you've thought about yet?
Oh, go ahead, Elise.
Oh, I was just gonna say, so the group that we had talked about, MSSI, is kind of like they have been able to get funding, and one of the members is a county commissioner, so she's working for funding at more of like a state and county level.
I love to hear about the ways that you're plugging into the existing system. I think that's really smart.
Yeah.
Because of the urgency of the issue that you're tackling, like those partnerships are going to help you have impact faster and without replicating, which is important.
Mhm.
I'm learning that I'm not a very good question asker. I'm just like, let's just figure out this problem. I'm gonna work on my judging skills here.
This isn't a question either, but it's a follow-up on Suzy's comment, I would say, which is, you know, with the new infrastructure plan that the Biden administration is putting forward, there's going to be a lot of replacement of buses and other transportation infrastructure. So, you know, I would try to be first in line for some of those still very viable, but not quite state-of-the-art AATA buses. And maybe also, you know, there are other transportation entities in the region that are going to be swapping out a lot of buses much more quickly than they had planned to. And I do think that the whole idea of the circular economy and being sure that those buses are put to really good use as the new buses are phased in, it's going to give you a very compelling sustainability strategy. So yeah, get in touch with the folks at A3TA.